Greetings everyone. I would like to welcome you to our webinar and also welcome Madam Neema Baira from Save the Children International Tanzania. And she is going to be highlighting us on amid COVID-19, the budget of the health sector. So Neema, karibu sana.
Policy Forum through the Budget Working Group in April 2020, we really worked to analyze the national budget, and we prepared the pre-budget position statement, which was focusing to highlight some issues around COVID-19 and the health issues. And we really managed to analyze all the sectors that have been affected by COVID-19. Also provided some critical recommendations to ensure that really critical issues are properly addressed. So we are going really to ask ourselves, COVID-19, what does it really mean for Africa, but again for Tanzania? It is estimated that the economic cost of COVID-19 will really exceed $1 trillion, putting increasing pressure on countries already crippled by debt crisis. We are going now to see how COVID-19 really impacts on the health sector. There are so many critical questions that we have to ask ourselves, particularly in the health sectors. For example, how are the health system prepared? We are talking about the hospital beds per 1,000 people, the health staff shortages. Therefore, key sectors from social to economic have been really massively affected, leaving the livelihood from both the formal and informal sector in a very serious concerns. Due to the prevalence of other diseases, meaning millions of people may be immunocompromised and more at risk of serious complication from this respiratory disease. Though, as we speak right now, the deaths in Africa is still quite low compared to other places, but the effects in the area of economic is really quite obvious. Going deep to the healthy sector budgets and COVID-19, for the current financial year that is going to end very soon in end of June, the health budget is really accounting 5.9% for the total budget. But we have experiencing an overall trend of the health budgets declining for the past 2 years. According to the minister's speech budget's presentation, actually only 440 million Tanzanian shillings has been allocated for epidemics, accidents, and disasters, including COVID-19 responses. Will this be enough to address all emerging issues of COVID by using only that kind of budget? Daniel, over to you. Please, you're welcome.
Thank you very much, Neema. In terms of key takeaways in the Ministry of Health budget, so we see there's a bit of a reallocation from the Ministry of Health budget to the regional administrative secretariats. The Ministry of Health development allocation decreased by 34% from the 2019-20 budget to this year's budget. This year's budget is 361 billion, which is a decrease from last year's budget of 544 billion. You also see a difference in terms of the share of the allocation, which for this year's budget is 48% of the total development budget, as opposed to 68% of last year's health development allocation. Right now, the total that goes to the regional administrative secretariats is 49% of the health sector development allocation, as opposed to 31% of last year. As we look at the Ministry of Health budget, what we see is there has been a considerable decrease in two major development partners allocations, which is the Global Fund and the World Bank. If there's continuing decreases, there's going to be problems in terms of a funding gap. It will be important for resource mobilization to be prioritized in order to make sure that we're not going to have issues funding the health sector in the future. In terms of the total funding impact in the health sector, there hasn't actually been a decrease in the health sector in terms of funding. It's actually gone up slightly. This is because although there's been a decrease in global fund funding, there's also been efforts by the government of Tanzania to increase funding to the recurrent budget as well as the development budget. And there's also been help from other donors to increase funding allocation to the development budget.
I hear a lot of decreased terminology. Everywhere we are talking about budget decrease. Probably we need money now more than before, but where is the money? This is the very critical question that we need to answer as well.
Question and answers session. So we'd like to hear from you. What do you think? Whether you're watching us from YouTube, whether you're watching us from Zoom, do you think the local governance authority have done what it needs to be done to raise awareness to the grassroots communities on COVID-19?
I think besides it being an issue of education, it's also what is practical for the common person.
What does COVID-19 mean to children?
Many people have been affected with this, but children have been affected very much. They are not in school, so it means even their right to education is denied by the crisis itself. There is also tension for children themselves. There is a lot of psychological issues, but also there is also some physical abuse that really are happening to children. They lack care at home, so they might find themselves falling into so many types of abuse, could be sexual, could be physical harm and everything. So it has a lot of effect to children.
So there are a lot of efforts that has been done by the government through the Ministry of Health and the local government authorities to really ensure that COVID-19 is very well addressed, including measures to strengthen the detection at the point of entry, such as airport, cross-cutting borders, and the training of many medical staff on case management, risk communications, and community engagements at large. Due to cessation of gathering caused some close of some of the businesses and uncertainty of whether they are to return in the near future, this in turn will also affect the revenues. What we are seeing as development partners in Tanzania, as civil societies, we need really to ensure that there are some certain physical and tools that needs to be really appropriately considered for the Tanzanian context in helping safeguarding people and businesses from the prevailing challenge. We are part of the world, we are part of the crisis. To adapt to COVID-19 like the way we have been living with HIV/AIDS and everything. So we need really to make this a reality.
We would like to thank you very, very much for being with us, for listening to Neema and Daniel. And for now, it's a wrap until June, where we'll be discussing the Open Budget Survey 2019. Thank you very much, and karibu June.